My name is Marcy Goolsby. I'm a primary care sports medicine physician here at HSS and the medical director of the Women's Sports Medicine Center. I treat a lot of different issues, ankle sprains, knee injuries, hip injuries, elbow, hand, shoulder. I do see a lot of stress fractures in my practice as well, so that's sort of one of the specialties that I have. So I'll see patients who are coming in that are concerned about having a stress injury, or patients sometimes that are even have that diagnosis already. And they'll come to me to sort of discuss the management of it and identify why it might have happened. I like to take a more comprehensive approach to the patient and really try to treat the whole patient. What are they doing in their daily lives in addition to their sports and exercise so that they can continue to be active and healthy? One of the things that I think is really important is identifying why the injury might have happened in the first place, because in order to get them back safely, ideally that doesn't happen again, and that in my practice applies particularly to the stress fractures. It's not unusual for us at HSS to see patients who've seen other providers prior to us, and I think it's important when you first see a patient to sort of address all of those issues that may have happened before, because it's important to try to get the diagnosis right the first time through so that you can formulate the best treatment plan. We're teachers as physicians. I think that's one of our main jobs. We have to listen, and to be able to be a good teacher, you have to listen and get the story right, and then you have to do a good exam. And then afterwards, it's important to me that my patients understand what I think the problem is, maybe what I don't think the problem is, and how I'm going to determine whether that's the problem or not, how we're going to treat it, and having them understand the nuances. It's not unusual for me to pull out my old anatomy book that I keep in the office with me to show patients exactly what the anatomy is in that area, what I think is causing the pain and why, so that they're invested and they understand and they retain the information better when they leave. It's really rewarding, and most of the patients, if they're feeling better, they don't come back. And I love those messages that say, "I'm doing great, thanks so much, I'll see you when I need you." And also sometimes patients will come in to tell me that face to face, which is really nice.